how does the new health care bill affect you?
Well, I don't know. Might get overturned. They said as early as Monday. It's in the Supreme Court right now. And it depends on what they decide. It'll depend on they're gonna do one of three things. They're either gonna uphold it, reject it completely, or keep part of it and throw the other part away.
Right, and I hear that if they keep the part of it and don't do the mandatory
right,
that it might be worse.
Yeah, they say that the cost implications are worse if they do that, but yeah, I don't know. We're all kind of on pins and needles waiting to figure out what they're going to do with this thing because nobody's got a clue. Nobody can figure out how to stop spending money.
Right, and the whole economy is waiting.
Right.
Just waiting to see what's going to happen before they're going to spend any money.
Probably one of the biggest decisions they've had to make, and I don't know, as far as I can remember, you know.
Well, I think the plan, the way they structured it, was to make sure that companies can't afford it. The companies will have to pay a penalty and put everybody on a public plan. I think that was the intent.
Right. I mean, the way it's written is very much a socialist piece of legislation.
Well, you know, when it comes right down to it, Medicare and Medicaid are socialist programs.
Yeah.
Which,
I certainly think people have the right to access care, but
not to be forced. I mean, not to be forced.
Not to be
forced to pay an insurance company.
Right, exactly. I mean, that's the biggest problem. I mean, it's not like the insurance companies are barely skating by. These companies are making millions of dollars a year.
But that's why they liked it. Just because they're going to end up making like AARP was all for it, you know.
Right. So I mean, what I think they need to say is that there need to be some certain things the insurance companies can and can't do, and jacking up costs and rejecting to cover people because of medical conditions is wrong.
Yeah.
It's.
But somebody has to get paid.
Right.
There's a guy working in a motorcycle shop, and he's fixing bikes and engines and stuff, and he sees this cardiologist walk in, and he's standing there with his buddy. He said to his buddy, I want to talk to this fella. He said, hey buddy, come over here, He came over and he said, how come when I take an engine, I work on the valves, I pull the valves out, I clean everything up, put it back together, how come I get paid $40,000 a year and you get almost $1 million a year? And the doctor smiled and said, have you tried doing it while it's running?
Yeah, right. Yeah, pretty much. Pretty much.
I mean, I can go out and I can get a book and start tearing through an engine, but I can't get a book and start putting a heart in.
No, it's a little different. Yeah, it'll be interesting to see.
What would have happened? Say back, who was it that got Medicare started? What president pushed that through?
Oh God, I remember before my time. Was it Kennedy?
It might have been before him. No, it was FDR.
FDR, yeah.
Yeah, total progressive. And what would have happened if that would have never happened?
Yeah.
I think the prices of everything would be normal.
Right.
I could go in and pay cash for an MRI.
Yeah. That's interesting. I don't know. I mean, the other thing that is a major cost thing is the drug companies. I mean, they spend, part of it's their fault, part of it's not their fault. I mean, if a company has an idea for a new drug, to take it from a chemical to something that the FDA approved costs millions and millions of dollars.
I think
whatever,
billions after they get the production,
and part of it's good, because it's a safety thing, but so they feel like they can charge, what they want for medicine.
Right.
Companies will say, well, we'll pay for, a lot of the insurance companies have this thing where they give you sort of X amount of dollars per year that you can spend on medicine, and then after that you fall into some black hole and you gotta pay for it out of your own pocket. So it's frustrating from our end because you got a patient who's doing well on medicine, and then 9 months later they can't get it anymore because no one's paying for it. They can't pay for it because it's too expensive.
Right.
money, and this will never happen because the people that run Congress are all lawyers, but it's the lawyers are the problem.
Tort reform.
Yeah, I mean, that's the problem. I mean, because what happens when people are getting sued for millions and millions and millions of dollars is that you defensive drive all day long, and you order a lot of tests you don't really need to order, but you do it because, God forbid, you miss the 1 in 1,000.
Right.
Lawyers up your ass, and, you know, your family's listening, so.
Yeah, just think about the cost that's incurred by malpractice insurance every year.
No, it's unbelievable.
What's like 80,000 a year, isn't it?
It depends on what you do.
Yeah.
You know, but certain things are higher than others.
And if we got tort reform, then that would go down to what, maybe a manageable amount, like 15,000 a year.
Yeah, I mean, it's part of it. It's not just the payments from the insurance, but it's all the tests that get ordered and all the costs that come from that stuff. It's just,
And they do it to cover their butt.
right. Well, that's right.
To keep the insurance companies from suing them, or to keep the
Yeah, that's right.
lawyers from suing
Right.
them.
So that's part of the problem too. But you know, you can't tell a lawyer that.
No, you can't tell.
Good luck with
But
that.
Texas, they started a
Yeah,
you
Texas,
play, you
Wisconsin,
pay.
and Indiana are the 3 best states for
Because a lawyer has to think twice about it before he takes up a suit.
Yeah, because the case has to be reviewed by a panel of doctors before it can even be, you know, brought to the court. Like they have to give it, there has to be some validity to it before it can even, so it's a big deterrent to frivolous nonsense. It works well in those states. I mean, those states, if you talk to people about, you know, you have friends that are doctors in those states, and people are happier there than any, you know, anywhere else.
I mean, when in my lifetime would I ever see over 5,000 doctors protest on Washington, D.C.?
Yeah.
That happened a couple of years ago.
Yeah.
So they get a few doctors in white, they pass out white coats,
Yeah.
and then take a photo off and say, all these doctors love this
Yeah,
idea.
get over here.
As soon as Monday, I didn't know that, man.
Yeah, well, yeah, they said it as soon as Monday. They're not exactly sure, but that's the earliest.
I swear to me, it'll cause a revolution if they let it go.
Yeah, if they let it go, there's going to be.
There sure is.
They don't know what the right thing's going to be to do. They
No.
can't.
Well, Nancy Pelosi, sure it's constitutional. She came out today and said, well, it's completely constitutional.
Yeah, she said,
And like she cares about whether it's constitutional. In fact, when somebody asked her about it, her reply was, are you serious? When they asked her if it was constitutional.
Right.
She said, are you serious? Like, we give a damn about the Constitution.
yeah.
They're following some guy in prison wrote a book on how to transform and implement these things in this country. And his first thing was you have to start with health care,
Yeah.
which they did 60 years ago with Medicaid, Medicare, and Social Security. So now they're just trying to put the last nails in the coffin.
Social Security won't be around when I'm.
No,
I
no
don't pay
matter.
into it anymore.
Oh, well, good.
They give you an option to either pay into that or pay into like a private retirement account.
Oh,
What
really?
the hell am I going to pay into Social Security for? I'm never going to see the money anyway.
Right.
But it won't be around for 20 more years maybe.
Yeah, privatization of health or Social Security is a great idea,
Yeah.
but they scare everybody. You know, like when they came out with the idea, or when they tell that people that have already paid in, you're going to lose your Social Security.
Right.
Well, that's not the case. The case is the people that are starting.
Right, that's exactly right. That's exactly right. That's right.
my doctor, before all this, was right over here off of Buttermilk Pike.
Yeah.
And I was cash, you know, and he was fine with that. He'd do whatever he needed to do, and then just tell the secretary he's cash is $30.
Yeah.
But now, since the healthcare bill, he had to join a group.
Right. There's no more small guys.
And no more deals.
You can't survive.
So now it's gone up to $55 if you're paying cash.
Right.
But that's because it's on the books.
Yep, exactly. Yeah, the hospitals are, and I'll tell you what they're doing. So they're buying out, you know, all these small practices and incorporating them into, you know, the hospital system. And what they can do actually, just for a clinic visit, nothing to do with an in-hospital procedure, but if the hospital owns the clinic, they can bill twice for the visit. They can bill once for the doctor fee, and the hospital can bill what's called a facility fee. Just for you to walk, and you can't. And if you're a private doctor, you can't do that. You can only bill for your part.
Right.
But that's so the hospitals are another. They're making a killing.
Oh, I know.
They're double billing for everything because of the loopholes and making a killing.
Yeah, I about panicked. I put my son in the ER about a month ago because of a parasite.
Yeah.
And once I realized, I said, "Oh, I know what this is. It's so and so." And he's like, "What the hell's that?" It's like, "Okay, we're going to go to the emergency room. I'm not going to try to. We're going, you know."
Yeah.
And $1,200 bill.
Yeah.
I was, and that was the insurance company. I didn't get a bill from the hospital yet.
Right.
But when I do, I'm going to get on the phone. I'm going to say this. I want this itemized. I want to know every little penny that went into this bill.
Well, you know how much they charge you for a Tylenol in the ER? About $75.
$75
for a Tylenol. I mean, it's unbelievable. I don't know how they get away. I just don't understand how.
Yeah, how do they get away with price gouging when no one else can?
They charge $75 for a Tylenol, and the insurance company says, "I'll give you $250," and then you say, "Okay." I mean, that's how it works. I mean, I have no idea how the system ended up the way it is. But that's what.
That's crazy. So if the insurance company was going to take care of the bill, they'd negotiate.
Yeah, that's right. Everything.
But if I have to take care of it because it's...
But you see, what you need to know is you can negotiate too.
Oh, okay. Without it being bad credit, or without it being...
No.
Okay.
A couple of my patients have these real high deductible things, so they come in for a test that, let's say, from start to finish, the endoscopy, the whole thing, the hospital, everything costs maybe $2,000. And I just tell them, call and negotiate. I mean, the insurance companies negotiate, the hospital, you can do the same thing. Tell them knock 20% off it, and you'll write them a check tomorrow, and they'll agree to it, trust me.
Right.
So you can negotiate.
Okay. Yeah, tell them it should be a cash price.
Yeah.
Because I still have to pay cash.
Right.
Because like my deductible is $2,500 for him.
Yeah, just tell them, hey, listen, we'll give you this, we'll call it a day. I promise you, there's a 9 out of 10 chance they'll say okay.
Alright. Yeah, because that kind of insurance for my son is really strictly catastrophic insurance.
That's what most young people have.
Yeah. I know it'd be covered if it ran over $2,500, which it could easily run over $2,500.
Oh yeah, I mean, so that's part of this new healthcare thing. The thought is that by making everybody have a mandate to have insurance, young people aren't going to use their insurance, so it's going to offset the cost for the older folks.
Which won't work.
Well, that's not true because you know, just like anything else in America, if you're paying for something, you're going to use it.
Yeah.
So every belly pain that a 20-year-old gets that he used to blow off, now he's going to come into the hospital.
Into the ER.
And the doctors are going to have to play defensive driving because of the lawyers. So now he gets a CAT scan, an endoscopy, and a bunch of blood work. And that belly pain that would have gone away in 24 hours with, Tums turned into a $15,000 event. And multiply that by, a lot of people.
Hundreds of thousands.
So you're not convinced that